Red Meat Correlation to Type 2 Diabetes by Michael Radke. Questions. Does the overconsumption of red meat cause type 2 diabetes? What is type 2 diabetes and how is it caused? Should I eat red meat? If so, how much? What is type 2 diabetes? It is when the pancreas doesn't produce enough insulin. It occurs when your body resists or doesn't produce an adequate amount of insulin. Affects the way the body produces blood sugar, glucose. Causes: obesity and an inactive lifestyle, as well as genetics. Treatments include changing of diet, exercise, medications, and insulin therapy. Risk factors for developing type 2 diabetes: being overweight or obese, being age 45 or older, family history of diabetes, having high blood pressure, low levels of HDL or high level of triglycerides, not physically active, heart disease or stroke, are African American, Alaska Native, American Indian, Asian American, Hispanic Latino, Native Hawaiian, or a Pacific Islander. Lifestyle changes to prevent or reverse type 2 diabetes. Nutrition changes, like eating whole grains rather than refined or processed grains. Eating healthy fats like salmon, avocado, nuts. Limiting red and processed meats. Replacing sugary drinks with water, coffee, and tea. And limiting alcohol consumption. Exercise. Inactivity promotes type 2 diabetes. Exercising helps maintain a healthy body weight. Working your muscles more often improves their ability to use insulin and absorb glucose. Weight loss. Changing your nutrition and your exercise will help you maintain a healthy weight. Being overweight or obese is the cause of type 2 diabetes. Red meat nutritional information. 3 ounces of ground beef contains about 250 calories, which is 17 grams of fat, 6.6 grams of saturated fat, 7.2 grams of monounsaturated fat, and 0.6 grams of polyunsaturated fat. 22 grams of protein, 54 milligrams of sodium, 271 milligrams of potassium, 74 milligrams of cholesterol, 13% iron, and 2.5 micrograms of vitamin B12, for a total of 37% being protein and 63% being fat. 0% is carbohydrate. Recommendations for red meat consumption. Limit consumption to about 3 portions per week, which is 12 to 18 ounces cooked. Choose lean cuts containing 10 grams of fat or less, 4.5 grams or less of saturated fats, and less than 95 milligrams of cholesterol per 100 grams and per labeled serving size. The U.S. Dietary Guidelines recommends for a 2,000 calorie diet, 26 ounces per week of meat, poultry, and eggs, with no specific number for red meat. U.S. National Library of Medicine and National Institutes of Health. They conducted a study showing a higher prevalence of type 2 diabetes in people who frequently eat meat. It shows a decline in type 2 diabetes prevalence as less amount of meat is consumed, and shows a non-vegetarian is twice as likely to have type 2 diabetes than someone who is vegan. Correlation between type 2 diabetes and red meat. The U.S. National Library of Medicine and National Institutes of Health concluded that high meat consumption correlates to developing type 2 diabetes. They came to this conclusion through 3 large Adventist cohort studies that high meat consumption raised risks of type 2 diabetes. Conclusion. Does the overconsumption of red meat cause type 2 diabetes? There is a correlation between overconsumption of red meat and type 2 diabetes. Correlation does not show causation. Overconsumption of food leads to obesity, which is the lead factor in type 2 diabetes. Should I eat red meat? If so, how much? Red meats are recommended to be consumed less because of their high fat content. Limit red meat consumption to 1-2 times per week, 6 ounces or less. If you have heart disease or high cholesterol, limit to 3 ounces or less per week. The USDA recommends to select leaner cuts of meat with less fat. And these are my sources. Thank you.